And welcome back to our fourth and final back rehabilitation video. My apologies for getting this video out late. We've been very busy with work, and with a lot of work goes into these videos, including editing and processing, and it's come out a bit late, but at least we're here now. Before we start this video, I wanted to say a huge thanks to everyone who's for the tremendous support that has poured in from all across the world. Different people messaging me from different countries, uh, emails thanking me for this video series, patients coming in and their pain is much better. The back pain that they thought they had to live with has improved significantly and they're doing much better. So another thing we realized with the videos was that while a lot of people do them, they start with enthusiasm, the enthusiasm slowly weans down, and there's a lot of fallout rates that not continuing with phase 2, phase 3, and finally phase 4, and then going on and hitting the gym regularly. So we're developing a motivational series also, so that maybe that's exactly what you need to keep you on track. But as soon as that's developed, I'll be attaching the links to that shortly. So for now, here's the fourth and final phase. As always, we begin with the core strengthening exercise. Neeraj, a fitness trainer, is demonstrating this. So in this, you're lying down. You've already done this through phase 1, phase 2, and phase 3. But this is a very quintessential core strengthening exercise. So with the knees straight, you lift your leg up and you do this 50 times on each side. You can take as many breaks as you want, be comfortable, but do them with good form. The second exercise is a partial plank. So in the beginning, when you start trying this out, do it with on your knees and elbows. Try to hold it for 30 seconds. And once you get good at that, then you can progress to the full plank, which is between your toes and your elbows and keeping your body straight. Again, do it for 30 seconds. There's no need to do it for more than that. Keep your body straight like a plank, focus on the form, breathe normally. You want to do the plank at least 2 to 3 times. The third exercise, now that you're doing the plank, is to hold the side plank. Now the side plank will work the side muscles in the abdomen, which are very important for supporting the spine. So you go into the side plank and you hold this posture for again 30 seconds. Do it on each side for 30 seconds and do this maybe 2 to 3 times. Again, the focus is on the form, on the breathing. You try to be as still as possible, feel the muscles become tight, and you know you're doing the right thing. In this video, the back extension exercise are in a partial plank position. So you're in this position and then you do your back extension exercises. So this will be working out your core and your back strengthening muscles all at the same time. It's a very good exercise. You do this 25 times on each side. So now you're at the 6-month phase of doing these exercises. If you're feeling very comfortable with them, if you become very strong at your core level, then you can start hitting the gym doing other exercises. These are excellent for post-surgical patients, for those who can. If you feel any pain while doing the exercises, stop, take a breather, don't push it, come back after 2 to 3 days and try it again. So as you see, Neeraj's form did not change throughout the exercise. He maintained perfect form, perfect breathing, and he did the exercises. So you should try to do the same at home. The fifth exercise is a posterior chain stretch. So you're sitting down with your knees straight and slowly push your body forward till you touch your toes. And that's all you do here. You hold your toes, you feel a stretch in your hamstrings, feel a stretch in your calves, breathe normally, and hold it for about 30 seconds. You can do this 2 to 3 times. Don't hesitate. Feel free to go a little bit deeper into the stretch. The more you stretch, eventually the better it is. However, if you try to stretch too much too fast, your body will tighten up and you won't be able to do it. And a stretch for the rotators, a very simple stretch while sitting down. You can do this anytime. So you're sitting down in this position, stretch out to one side, hold that for 30 seconds. This works all the rotators in the spine, and then do the same on the other side. So with this we complete phase 4. If you all are my surgical patients, or if you've undergone spine surgery recently, especially a disc related issue, then this is where you stop. However, I have added a couple of supplemental videos for those who don't have those who aren't surgical patients, and those who are working out just for back pain and they're looking at strengthening their back. So these are supplemental videos only for those who are not surgical patients. So this is the hip mobility. If you can, you do it. This was there in the previous video, but I've added this as a supplemental video here. A lot of feedback came that this was very difficult to do, so I've asked people who find it tough to just not push it too much. So you do this on both the sides. Do it about hold it for 30 seconds. Do it about 2 to 3 times. And the last supplemental video is the walk. So you walk with your hands and let your body open up, and then staying in that position, you bring your feet closer to your body, keeping your back as straight as you can. And this is a very good core strengthening exercise. However, if you're post surgery, it's better to avoid it. So now you do this till 6 months are done, and once 6 months is done, you can use this as a warm-up in the gym. But don't stop here. Continue doing them every day and move on to more challenging exercises. Remember, you have to challenge yourself. The body only gets better. You only become stronger when you challenge yourself. This is not just physical, mental. There are many aspects to it. The more you challenge yourself over a longer period of time, the better you get. So continue doing the exercise. I wish you all the very best, and I'll see you soon.